Pregnancy. Now we are going to go over the psychological and physiological changes during pregnancy with each trimester. With each change, there will be important nursing actions to consider. Let's go over the psychological changes first. The first psychological phase is ambivalence in the first trimester. This is when the mother can start having mixed feelings or contradictory ideas about having the baby. As a nurse, you will need to assess the meaning of pregnancy to the client/partner and socioeconomic supports. The second psychological phase is accepting. This happens during the second trimester. Most women are able to change their attitude toward pregnancy by the time they feel the baby move inside them. Assess if ambivalence is increased and how the client views the fetus. The third phase is preparing for birth. This happens at the third trimester. Nursing actions include teaching signs and symptoms of onset of labor, newborn care, feeding methods, birth control, and home preparations for baby. Also, you will want the review birthing plan with the mother. Now let's go over physiological changes that happen during pregnancy. The skin will have changes such as striae, linea nigra, and chloasma. This happens during the second, third trimester. Discuss that commercial treatments are not useful and that pigmentation usually disappears. After pregnancy, striae may fade. Breasts changes will occur such as size, striae, and tenderness. This happens in the first trimester. Teach that fullness and sensitivity are hormone-related. Instruct about supportive bra and that over-the-counter products do not reduce stretch marks. Another change of the breasts is colostrum. This happens in the second, third trimester. Teach that colostrum may be expressed as early as 16 weeks. Discuss breast care pads and nipple care. The best thing is to keep the breast and nipples dry to prevent infection. Respiratory changes such as dyspnea will occur. This happens in the second, third trimester. Teach the mother to sleep propped up or sitting up. Dyspnea will worsen as lightening occurs, which is when the fetus begins to descend into the pelvis. As the mother sleeps propped up, this allows her to breathe easier. Cardiovascular changes such as faintness and syncope. This happens in the second trimester. Encourage moderate exercise, deep breathing, side-lying position. Avoid sudden changes in position. Another cardiovascular change are varicose veins. This happens in the second, third trimester. Assess activity and promote a balance between sitting/standing, and avoid the use of constrictive clothing and crossing legs. Teach leg elevation, position changes, support hose, and exercise. GI changes such as nausea/vomiting. This is common in the first trimester. Here you will want to teach a focus of a specific diet. Promote dry crackers, 5 to 6 small meals, ginger, raspberry. Teach the mother to avoid fried, odorous, spicy foods and foods with strong smells. Assess weight, urine output, and signs of hyperemesis, which is a severe form of nausea and vomiting during pregnancy. Hyperemesis is an issue if they cannot eat or drink for more than 24 hours, urine becomes scant and dark, heart pounds, or client becomes dizzy. They must call their doctor immediately. Another GI change is constipation. This may happen in the second, third trimester. Teach about activity, fluids, and fiber. Heartburn. This occurs in the second, third trimester. Encourage small meals and teach the mother to sit upright for 30 minutes or more after eating. They should avoid spicy, fatty foods. Drinking hot herbal tea can help prevent heartburn. GU changes include urinary frequency. This will happen during the first and third trimester. Assess for urinary tract infection. Teach the mother to void frequently to prevent infection. And to avoid decreasing fluids. Call provider if they are experiencing dysuria, cloudy or foul-smelling urine, or flank pain. Teach Kegel exercises. Leukorrhea is another expected change. Leukorrhea is vaginal discharge during pregnancy. This can occur during the second, third trimester. Teach that this is normal and they should never douche. Promote good hygiene and wear perineal pads. Teach to report if accompanied by pruritus, foul odor, or change in character. Braxton Hicks. These are contractions that tighten in the abdomen, and it comes and goes. This happens during the second, third trimester. Teach the difference between Braxton Hicks and true labor. Nutrition. Through all trimesters of the pregnancy, you will need to assess and teach weight gain patterns. The average weight gain is 25 to 35 pounds with an caloric increase of 300 to 400 kilocalories per day. Promote protein increase by 25 grams per day, iron intake 30 milligrams per day, folate intake 600 micrograms per day. Encourage the use of prenatal vitamins and teach to limit caffeine intake. In the next video, we will cover presumptive, probable and positive signs of pregnancy.